If your doctor told you your blood pressure is perfect, I want you to pause for a moment. Because for some people over 60, that perfect number may not be as safe as it sounds. And most people don't realize this until something feels off. Maybe a little dizziness, maybe a moment of weakness when you stand up, or just a quiet feeling that something isn't quite right. Let me ask you something. Have you ever stood up from a chair and felt slightly lightheaded? Just for a second. You ignore it. You tell yourself it's normal. But here's the surprising part. Your body may actually be trying to tell you something important. As we get older, our bodies don't respond the same way they used to. What worked for you at 45 may not work the same way at 70. And this is where it gets risky, because many people are still being treated with the same targets, the same numbers, without considering how their body has changed. Most people are told one simple thing: lower blood pressure is always better. And in many cases, that is true, but not always, and not for everyone. I'm Dr. William, a certified cardiologist with over 40 years of clinical practice. You're watching Seniora Health, where we talk about simple ways to protect your health. And today, I want to help you understand something that could quietly affect your safety every single day. The common mistake I see again and again is chasing a number on paper instead of listening to the body. A reading like 120/80 looks excellent, clean, controlled, textbook perfect. But here's what most people don't realize. That number is usually measured while you are sitting, calm, still, in a controlled environment. But your life doesn't happen sitting still. You stand, you walk, you move, and that's when things can change. According to medical research, some older adults experience something called a drop in blood pressure when they stand. Studies suggest this can increase the risk of dizziness, falls, and even injury. And this is where it becomes important, because the issue is not just your blood pressure, it's how your body handles change. So why does this happen? Let me explain in a simple way. As you age, your blood vessels become a little stiffer. They don't adjust as quickly as they used to. At the same time, your body's internal sensors, the ones that regulate pressure, they slow down slightly. So when you stand up, your body may take a few extra seconds to adjust. And if your blood pressure is already on the lower side, that delay can make you feel lightheaded. And there's another factor most people don't think about: medication. According to research, the body processes medications differently as we age. That means the same dose that worked perfectly years ago may now affect you more strongly. Not because anything is wrong, but because your body has changed. Now, stay with me, because there's one more thing most people ignore, and it could make a big difference for you. There is a very simple test you can do at home. No complicated equipment, just a basic blood pressure monitor. You lie down, rest for a few minutes, and take a reading. Then you stand up and take another reading right away. If there is a noticeable drop, your body may be struggling to adjust. And this is valuable information, because research shows that identifying this early can help prevent future problems. Now, this doesn't mean your treatment is wrong, and it doesn't mean your doctor made a mistake. It simply means your care may need to be more personalized. Because the goal is not just to reach a number. The goal is to feel stable, safe, and confident in your daily life. Here's what studies suggest about blood pressure in older adults. For many people over 60, especially those who are active and stable, a slightly higher range can still be safe as long as it is well managed and monitored. At the same time, Very low readings, especially when combined with symptoms like dizziness, may need attention. But here's the key idea I want you to remember. It's not about having the lowest number. It's about having the right number for you. And this brings me to something I mentioned earlier. There's one simple habit that can change everything, and most people completely overlook it. It's this: pay attention to how you feel, not just what the machine says. If you feel steady, clear, and balanced, that matters. If you feel dizzy, weak, or unsure when standing, that matters even more. Because your body gives signals long before a serious problem appears. And when you combine those signals with simple monitoring, you give your doctor better information. Better information leads to better decisions. So here's what I recommend. Start noticing your daily patterns. Check your blood pressure at different times. Pay attention when you stand up. And if something feels off, don't ignore it. Bring it up. Have the conversation. If this is something you've experienced, I'd really like to hear from you. Tell me in the comments, have you ever felt dizzy or lightheaded when standing, even occasionally? Because your experience matters, and it may help someone else recognize their own symptoms. If you found this helpful, consider liking the video. It helps more people see information like this. And if you want clear, simple guidance like this regularly, you can subscribe, so you don't miss what could make a real difference in your health. Let me leave you with this. Your blood pressure is important, but you are more important than the number. A perfect reading means very little if you don't feel safe in your own body. So take a moment, listen to what your body is telling you, and make sure your treatment is working for your life, not just your chart. Because when you find the right balance, you don't just protect your heart, you protect your independence. And that is what truly matters.